Okay, well, welcome everyone. And we're going to do a little segue before we get into the Q&A. So what I'd like to do going forward is to ask you, we're going to have a Q&A pretty much every month. And what I would like to really suggest is that if you have a really pressing or an interesting question, I would be very happy if you send it on to Janae or myself, and then I can prepare something of interest just to chat about as a little bit of an intro. So Bev Gradich did that, and I thought it was a really great idea. She said, I've got a question for you. It's might be a little bit kind of controversial, and but maybe you'd like to talk about it for the practitioner Q&A. And I thought to myself, well, that's a good thing because it gives us something to start with and just to break the ice. And then also it's a learning experience for everyone else. So we will definitely still have a good opportunity for all the other questions that you might have. But this one kind of leads us to covering a couple of things that we might be thinking in the back of our minds anyway. So thanks for that question, Bev. Mm-hmm. And I can see a lot of you guys joining us, so that's really awesome. Just going to be letting everybody in from the waiting room. So up on my screen is a paper from 2018. So it's not that new, but it's not that old. And it is focusing on autism, which we hear a lot about red lights in terms of autism. It comes with an Instagram account, and there's a practitioner using a little handheld device. And then she speaks about a research paper that compared this particular laser light, which was a 635 nanometer laser with a red LED. And she says, she talks about all the benefits from the perspective of managing this neurological condition. So this is someone who's in the autism community, and she works with photobiomodulation, and that is in the United States. We've got a number of devices that are registered, but what's quite confusing in this paper, and I think that's what really confused Bev as well, is that on that paper they say 635 nanometer red light laser made some changes, and red LED showed no changes. And the most important thing to realize is that they reused a very small red LED with very little power just to shine on the head so that people saw some red light. And that was the placebo. It wasn't actually a dosed and high intensity, properly medically designed red LED. It was LED for the light. Could I ask you guys to just pop your microphones off? That's awesome. So if you had to look at this paper, which showed a lot of really excellent benefits from the red light therapy delivered by this little device in the lady's hand, take it as being a situation where in the course of the paper, it implies that red LEDs do nothing, but that was LED. Okay, so I'm just going to do a little bit of muting of anyone that's chatting. So I just wanted to point that out, but it gives us a really good entry into talking a bit about using photobiomodulation for neurological health. So we're not talking about treating autism, but I want to show how when we understand what makes up neurological health, how our devices can be extremely beneficial. So just as a little starting point, remembering that we are really targeting a number of processes, and I'm going to just pop them up there. And the big four are your metabolism, metabolic fat loss. And number 2 is your wound healing, which you're all familiar with. Number 3 is your pain and inflammation. And number 4 is neurological health. And remember, cellular energy equals brain energy. So when we're talking about helping the mitochondria to work better, that makes the brain work better, because your brain has got some of the largest number of mitochondria in your brain cells, and it uses up, although it weighs about 2% of your body weight, it uses 20% of the cellular energy in your body. So it's very high demand. So we know that photobiomodulation, when we are helping the mitochondria, we are helping the brain in a very significant way. So if we look at autism, so a couple of things on here, but the mitochondrial and cellular and neurotransmitter problems in autism. So mitochondria aren't making cellular energy, and they are producing too much free radicals, too much oxidative stress. So there are a lot of reactive oxygen species in the cortex, where you think, the hippocampus, which is related to memory, and cerebellum, that's related to our movement. There's inflammation in the brain, and the microglial cells and the astroglial cells are like the immune cells inside of the brain, and they can get activated. And we see this again as a hallmark of autism and many other brain conditions. There's accumulation of reactive oxygen species within brain cells. You get that oxidative stress, and you get neuroinflammation and damage to the supporting cells and the neurons and the junctions. And you can get, in a sense, a leaky brain, like you would get a leaky gut. You also get problems in the way that the neurotransmitters are performing, and the wrong kind of signaling in autism. And remember, in autism, every child is different. So they've all got a mix, their own unique mix of all of these conditions and challenges. So there's problems in the way that the neurotransmitters are working. And then, interestingly, going out of the brain, there's a link to the intestinal microflora, and looking at the gut-brain connection, and some neuroactive components made in the gut that can have an impact on the brain. Too little serotonin and dopamine from the gut, and too much, perhaps, histamine. So lots of things happening in the gut that can actually affect the brain. So these are lots of different mechanisms that we see at play in a condition like autism. But we would see many of these in stroke, we would see many of these in dementia, we'd see many of these in Alzheimer's or Parkinson's, because these are all neurological conditions where the mitochondria are struggling. And this is a diagram that's really just showing what is happening in the autism picture. Mitochondrial dysfunction, oxidative stress, imbalance of what we call functional connectivity, things that should be balancing in the brain, structures in the brain that should be balanced are not operating in balance. An imbalance of synaptic transmission, so that's the carrying of the nerve impulses, problem in what we call long-range connectivity, information going long distances, early cell death, so the brain can get smaller, inflammation, and then here changes in some of the neurotransmitters that are important in the brain, that are out of balance, they're out of sync. And then applying photobiomodulation, we see mitochondria feel better, so we get our energy back, the cell homeostasis or balance is restored, growth factors come back to the right levels, decrease in inflammation, and then a restoration of the balance of the connectivity in the brain. So from a neurological health perspective, in supporting any kind of neurological condition, photobiomodulation is fantastic. We're not treating autism unless you are a neurophysiologist, psychiatrist, psychologist, someone who has got, shall we say, it's in your scope of practice. So we've gone through all the things that can go wrong, and then just reminding when we do all this good work with photobiomodulation, we get a bunch of really good things: decreased inflammation, connectivity is restored, and actually when we improve brain function, you actually improve the microbiome as well. Whether you only treat the brain, and there's even a brain benefit if we treat the gut. So again, that's systemic benefit. And the device that they used in much of that research is a device like that. So you'll see on that slide, they had a picture as if there was something on the brain shining light. And the device that's been most researched is something called the V-Light. And I work with someone who has a V-Light, and we play with both things at the same time. We play with my midwave panel, and we stick the V-Light on someone's head, and we put them head to head. We play around with them. I want to bring your attention to this. So they're dosing at the back of the head, 60 joules per centimeter squared, front of the head, 45 joules per centimeter squared, and then they stick a red light up the nose because the membrane is very thin, and so the light goes into the brain from the nasal passage, which is quite clever, at 15 joules per centimeter squared. And you will say, well, can the midwave panel do something similar? And I want to just point out, if you've got a contour, we've got a neuro, this is your neurological health protocol, and it is matching. On that V-Light, you get 60, we get 54 joules per centimeter squared, pretty much the same. If we do 10 minutes on the front, you're getting up to 48, and 5 minutes on the front, you're getting to 25. So that dosing tries to mimic, because this is by far the most researched transcranial device that is on the market for this kind of delivery that is not sort of handheld. So our dosing guidelines are absolutely going to be hitting the spot. Just remembering when you are using your dosing guidelines, eye protection when you are treating over the head is absolutely mandatory. When you're treating on the back of the head, we're not as worried. We still want the protection. But if you've got that light over the front of the body, then you want to be very, very, very particular about eye protection. So you'll have those protocols, and we are using the benefits of all these multiple LEDs to overlap at the target level. And what that allows us to do is have enough energy to get way past the skin and the cell, and the skull, and get to interact with the brain itself. And we know that infrared is the one that goes through the bone much easier. But what the red does is so if you have a contour, which is the 635 nanometers, the red, and that was the the wavelength, the 635 that was in the paper I mentioned right in the beginning, which showed such great results. But the red bounces onto all the appendages of the skin and allows that to draw the light deeper into the system, and particularly along the myelin sheath, which becomes like a fiber optic cable, and it carries the light further into the brain. So and photons are carried in the nerves as well. So even though we might say that we can't, when we measure, we say the red light goes a certain distance, the infrared goes deeper. What we do know is that the red has got a very good capacity to jump onto other appendages and activate and use that as a pathway to get deeper. And also it carries a lot of photon energy, which is means that it's got a lot to deliver to the tissues. So I wanted to open with that, and then I'm going to start taking some questions and also see whether Bev, if that's answered some of your questions. Great. So so that was a bit of a rundown. Yeah, Bev, does that make sense? And let's see if there are any other questions coming up. So feel free to unmute yourself, and we can take it from there. So I'll take any questions that you might.
Good evening, Doctor. It's Joanne. How are you?
Well, Joanne, how are you doing?
Doctor, can you hear me?
Yes, go ahead.
Okay. Hi, Doctor. It's Joanne. I just want to find out how many sessions are safe for somebody to use on a frequent basis. I've got a client that loves to come in. She's not battling with her weight, and that's not the reason she's doing it. She's doing it for health purposes and to relax, basically. She is a very individual, but she comes in for relaxation under the light and probably does 2 to 3 sessions a week.
So absolutely fine. You don't have to be sick or unwell to use the photobiomodulation device. It's great for general maintenance, and healthy people still get benefits even though they're, so I say, not sick, they're not ailing with anything. It's still, if I can put it this way, it's building resilience for them going forward, and actually it'll keep them healthy. So
there's no limit to the sessions.
Sorry?
There's no actual limits to say, listen, it's not good to maybe do 15 sessions. It's okay. If she enjoys the sessions, it's fine.
Yeah, I've had my photobiomodulation device for over a year now, and I must say, most weeks I'm doing it 2 to 3 times a week. I might skip one week very occasionally if I'm away, but and sometimes if I have had, shall we say, a kind of a big run or something like that, I might do sessions for recovery every day. So yeah, it's quite difficult to overdose, and most people, if they were overdosing, they would not enjoy their sessions. They'd be forcing themselves to come, and I think that's really important to kind of also listen to your body. If you don't feel like a session on a certain day, don't have a session. Your body's saying, well, maybe it's dealing with something else. So,
okay. And
yeah.
I've got one more question, sorry, regarding wound healing on a hand. So let's say fingers, right? Is it still 10 to 20 centimeters away from the hand?
Yeah, that's more than enough in terms of dosing. So absolutely no need to to go any closer than 10 centimeters. 20 centimeters, you're getting an adequate dose. So when you look at the research around wound healing, you've got research that goes from a 2 joules per centimeter squared dose right up to about a 40 joules per centimeter squared dose. And there's good results in a very wide range. And some of our wound nurses are probably going into the 70, even the 70 joules per centimeter, 75 joules per centimeter dosing and getting great results. So the body is appreciative of any light that it gets, and it certainly isn't scared of relatively high intensity. Your most important thing is that the client doesn't feel overly hot.
Yeah.
You absolutely don't want to be feeling hot.
Thank you.
Yeah. And so how you and I'm going to speak a little bit to Cornet's question here as well. How to calculate struggling with the correct dose and the risk of overstimulation. You will know that you've overstimulated when your client gets too hot and they complain that they're getting uncomfortably hot under the light. And then what you do is you've got 2 options. Take the panel up, which means you've got to generally take the panel up a good 20 centimeters if they've been complaining of heat, or you shorten the session so that they don't get to a point where towards the end of the session they're feeling uncomfortable. So that is your general rule of thumb. So Cornet, if you say I'm still struggling a lot with correct dosage and the risk of overstimulation, so what you would be doing in terms of looking at your dosing, and you would take the panel. If you have it at 20, take it up to 30 centimeters. And then what you would still potentially do is shorten the session to about between 5 and 10 minutes rather than 10 minutes. I see you mentioned there treating a patient 2 weeks post-operative for spinal fusion. Peri-wound area formed edema and blueness on the area of the SI joint. So the question really is whether that was induced by the red light, which is unlikely. So edema, blueness, that could very much have been a kind of a bruising from that surgery. If you are concerned, take the panel up, shorten, because if you want to calculate a dose, question is what dose are you thinking of using? So how do you calculate your joules per centimeter squared? We look at the irradiance. So if I can see if I can get that slide. But it's looking at your irradiance. So you'll see, let me share my screen so you can take a look at that. Let's see if we've got a dosing calculation on this slide. I'm going to have to go to a different, I'm going to pick up a different presentation for you. So essentially, so I'm going to get the calculation so that I can actually show that to you. But rule of thumb is always decrease your time and elevate the panel. I'm going to just, while I'm looking, okay, yeah, a very good point. That's just come up with Dr. Letabele. I've never been able to treat anyone at 20 centimeters. They all complain of being too hot. I always have to take the panel higher, but as I said before, all my clients are not Caucasian, so they're black, or Indian clients. They've got a lot of, they have a lot of pigment in their skin, so that dark skin is going to basically absorb the heat. So it's kind of like dark underwear. what you want to do is bear that in mind. So for our individuals with highly pigmented skin, that panel is going to go higher, 30, 40 centimeters, and then you can see if those individuals then tolerate their 10-minute session well, and then push their session into maybe 15 minutes, so they still get, although the panel is higher, that extended time makes up for that higher panel, but it just delivers the light in a way that they can actually manage it. So personally, I also really do find that I have my panel most of the time around 30 centimeters, 30 to 40 centimeters. So you can certainly go nice and easy and nice and slow. I'm just going to get that dosing calculation up so long. Right. So we had a look at that when we did the onboarding presentation last week. So I just want to pop that one up. There we go. Great. So we have our irradiance. So you'll see there will be a number, usually it's around 100 milliwatts per centimeter squared, 90 milliwatts per centimeter squared. That's your irradiance. And we're wanting to get that into joules per centimeter squared, which is the energy delivered over time. So we have 100 milliwatts per centimeter squared. We're going to set the timer for 10 minutes. So 10 minutes is essentially 600 seconds. So the calculation comes to 60 joules per centimeter squared. So it's 600 times your 100 divided by, in that case, 1 by 1,000, or you convert your milliwatts per centimeter squared into watts, and then it's 600 times 0.1, which gives you 60. So the formula is your irradiance, if it's in milliwatts per centimeter squared, times the number of seconds divided by 1,000. And that will give you a joules per centimeter squared. And if you are aiming to treat very, 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 very low dosages, then what you're going to probably need to do is rather than treat the individual for 200 seconds or 100 seconds, which is not a long time, so rather than treating them for 1 or 2 minutes, rather take the panel right up to 60 centimeters and let them still have their 10 minutes. That really is the best thing to do. Right. Does that make sense? So was Corne. And then a question here, feedback from somebody from Dashni. Increased or hyperpigmentation on face, is that possible? Often the red light has been found to actually decrease pigmentation. So again, we would want to kind of interrogate, get more details, etc. But again, always work with heat tolerance if it is your patient. How does the photobiomodulation stimulate hair growth? So if you wanted the hair on the head to be stimulated, how would you treat it? So essentially you would place the panel over the back of the head, person lying on the front, again at about 20 to 30 centimeters. The light will stimulate the mitochondria in the hair follicle. So if the hair follicle has been damaged due to the treatment on the legs, I forget what IPL stands for. If the mitochondria and the hair follicle has been damaged, it's not going to regrow. But if it's not been damaged, it might stimulate regrowth of the hair. So that's a bit of a conundrum. But yes, it stimulates hair growth predominantly via the mitochondria in the hair follicle. So a question around the use on one side of the body only. The client does not turn over and do 20 minutes over the waist area only. 20 minutes is probably not really necessary. You're probably going to overstimulate in just that area. But that would be, I know patients have this idea of more is better, but your mitochondria can only adapt to a degree, and then they are going to go into more oxidative stress because they've been overstimulated. So watch for heat on that individual. That's the most important thing. Watch out for the heat. Those individuals don't overheat. So more is not necessarily better. Is a 20-minute session a big problem? No, but not everyone's going to actually tolerate it as well as they should. And again, mitochondria don't like to be whipped into shape. You really do want to treat them gently. So you can get beneficial kind of response, and then the mitochondria will start to tire because you're overstimulating, and you lose some of your gains. It's very seldom that you will actually damage in any way, but what you will find is that that you lose some of the gains, and the body has to then mop up the extra oxidative stress because you've stimulated the mitochondria. So what are we trying to do? We're trying to stimulate mitochondrial function, make more cellular energy. At the same time, you are producing your reactive oxygen species. You produce just enough of that. It becomes a signal for the body to make more antioxidants. It becomes a signal to the nucleus of the cell to adapt. But too much oxidative stress becomes a burden, and you exceed your antioxidant capacity, and then you start to damage your mitochondrial membrane. So the membranes of the mitochondria start to become damaged. The body will not tolerate this, and so what it will do, the person will start to overheat. So what happens is that when you are making too much free radicals, your electron transport chains, which is those 5 cytochromes, instead of them passing the electrons around and getting oxygen across there, they uncouple. So they're not holding hands anymore. They let go of each other, and they stop the whole process to stop extra oxidative stress from occurring. When they uncouple, the only thing that can happen is that heat can be generated. So they're either passing electrons or they're making heat. People who find that they get hot, that's the signal that they're going into a little bit of uncoupling. So your client is generally going to get hot. They're just not going to be feeling that this is a pleasant experience. Susan, intense pulse light. Give me an idea of what you were wanting to know about that. Whether that was a question or not.
Valgo, I think that's the explanation for IPL.
Oh, intense pulsed light. Okay. To that actually damages, is it damaging the hair follicle, like a laser kind of laser hair removal? Okay, good. Any other questions? Right. Just want to check that I've covered everything. Yeah, so I think a really important aspect when we're working with the photobiomodulation is to just realize that it's modulating. We are not forcing anything in the body. It's also to trust the actual process. So a colleague and I have been doing a lot of work where we are also tracking the effects of the photobiomodulation on brain waves, on neurological output, on mitochondrial energy. So there are ways in which we can measure mitochondrial energy in certain areas of the body, particularly the brain. And a very nothing fancy 10-minute session has got significant effects on mitochondria. And so one of the things is just trust your modality, trust your device. It might not be doing exactly the thing that you think it's doing, but it's adjusting and it's modulating and it's putting the body into a better energetic state to find its balance. I think the other thing to realize is that your mitochondria are quite mobile. So what that means is that we do have free mitochondria that are able to move from one organ, travel via the bloodstream, and carry certain signals to other organs. So when we are affecting mitochondria in one area, we could well get other effects in other areas of the body that we're not even aware of. Mitochondria, just like cells, communicate with each other using particular chemical messengers. And the immune system uses cytokines. When it's activated and there's an immune response, your mitochondria make myokines, which are particular signaling molecules that the mitochondria use. That's their language of communicating with each other. So not only do they go and visit each other in different organs and go and talk to each other, they have all the signaling that goes on there. It's like they've got their own radio station going. So we certainly need to start thinking about the body in a much more sort of broader way than just sort of nuts and bolts. That's the way we generally think of everything as isolated. All the organs work by themselves. So Darshini, good question there. Heat over the testicular area, should we worry about that? It's affecting sperm quality in males with infertility issues. So we do know that the research is very encouraging in terms of photobiomodulation for male infertility and for better sperm motility, better sperm quality. Of course, talk to your client. Talk to your client. If your client says, that's quite hot, tone it down, take that device up. So we can definitely treat over the testicular area. There, again, you would use your common sense. Our devices are quite high powered. The skin of the scrotum is not that thick. So it's not like we're trying to get through the skull. So it's great. We can take that panel up to 40, 50 centimeters, and we would still get enough of a dose of those photons to that area. So yeah, as I say, quite good research looking at sperm motility and sperm quality. So something that you could use this for. again, communication with our clients really, really important. And again, always in your mind, we're not treating diseases. What we're doing is we are promoting health, whether it's metabolic and neurological, increasing the body's ability to heal wounds, and also increase moderating pain signaling. Those are your kind of big four. Always think of whatever you are working with, think of it in terms of those four categories. And certainly resist the temptation to kind of go out and say, well, I'm going to be treating infertility. It's more a case of, what you're going to be doing is focusing on cellular energy in different areas of the body. That's where you're heading. That being said, there's some very good papers on many conditions that have been affected in a very positive way. Good. Any other questions? Yeah, and has anybody had any adverse responses? Any other adverse responses that they're concerned about? Anything unusual that you're wondering, how did this happen? What happened here? Anything like that? Good. I think something that is quite interesting when you're working from the neurological health perspective, and increasing that brain energy, kind of bearing in mind that the brain is kind of a high energy organ. You want to be very particular when you're working over the skull, just to protect the eyes. So there has been a lot of discussions, and I've had quite a few questions about the trending discussions around photobiomodulation for the eyes. So I do want to just make it quite clear that our devices are much too intense. So red light is exceptionally good for treating the eyes, but those devices are particularly designed for ocular use so that you don't overstimulate all of those mitochondria in the retina. So the MedWave device is simply too intense to be used for any eye conditions. If you have an ophthalmologist that wants to experiment and everyone's got consent, and they are following up with regular proper ocular tomography scans, proper investigations to see how the eye is responding, that's one thing, but that is absolutely off-label, and we cannot in any way say that our device is cleared or registered for ocular use. It just simply is too strong. So you're on your own with that. It's quite wise to wear that eye protection or to cover with a little face cloth. Don't stare into the light. A question that we had earlier this afternoon was, the person who's operating the device and they walk into the room and it's all lit up with red light. Is that damaging their eyes? Most of that light is actually bouncing off the table. It's not coming from the device because the beams are angled down. So it's bouncing off the treatment table and the person's clothes and the person's body. So that's indirect, and it's probably not as intense as you can as it feels. So something that's really intriguing about the human eye is that it can detect 3 photons. That's how sensitive the human eye is. So you can see literally 3 or 4 photons. So it appears bright. See, when you shine a torchlight, and it kind of, you can see it glowing in your finger. That might not be enough light to have any photobiomodulation effect, but your eye sees it, because our eyes really do pick up those photons very well. They're very sensitive.
Oh.
So use your eye protection. Yeah, I mean, a patient once said that the treatment flared their lupus. It's quite possible, especially with your autoimmune conditions, that the body's signaling is not going as the best coordinated way that it should. And it's one of the reasons why we also wouldn't really recommend that we treat someone who's in an autoimmune flare unless they've got all the other supportive things in place. And then we'd still be a little bit careful, because they'd be on cortisone and other medications, which makes them a little bit photosensitive. Not that the skin is going to get damaged, but they might overheat. They're in quite a different physiological state being on those anti-inflammatories. And severe sinusitis, complains of headaches for 2 days after treatment. Yeah, kind of, that's very interesting. And I'm kind of wondering whether there isn't chronic inflammation there, and we're increasing blood flow to an area, and that is not helpful in that situation where they have sinusitis. Yeah, so there might be some things that you need to look into that. And then Gillian, on the is that a scanner menu is pets? I just want to make sure.
The scene menu is pets.
On which menu? So you could, if you were using your panel, you could treat a pet. I think be careful of their eyes. So you would definitely want to protect their eyes. So photobiomodulation is used extensively in veterinary practice. So, and most of the research has been done on animals. So animals definitely are very amenable to photobiomodulation, but you've got to watch out for their eyes as well. So just don't blind them. So yeah, well utilized in the veterinary space. Jen, you had a question?
Yeah, hi, thanks, Margot. Just a bit long for a chat. Some photographs today of a client who believes that she had some fungus on her nails, and you that they were weeping a bit, white towel over those nails. And then we treated them. And after the one session, she said, "Oh my gosh, look at them. They're looking so much better." Then I sent you the WhatsApp with the pictures, because it's gone black. She was going to go off to the farm, asked you what we could apply topically. She did say she was impatient and put too much Australian tea tree oil, and she thinks she actually burnt it and made it worse when she was trying to get rid of it a while ago. Were about to explode. That was the intensity. And, I've just been chatting to her because you advised about Sweden bitters, if that's the right way to say it, to topically. And I asked her, and she said, nail clinic that they believe had a batch of gel that's got that banned substance in it. And she said she was partly to blame because she did pull it off peel it off like I know a lot of women do. But why would it only have affected 2 nails on a whole hand of nails? Do you think maybe she could have had just a little hole, like a incision in her nail, and that's where maybe the chemical got in, that it didn't affect all nails? Or do you have any explanation about this? Because this finger situation looks
I don't
awful.
know.
Yeah, I think, yeah, I don't have any sort of, nothing sort of to add or anything wise to say about it. It's quite a complicated history. I missed a lot of it because the connection wasn't great. But I think that is a situation where and with so it's a situation where I think she should be pretty much seeing someone who's perhaps a dermatologist, someone who's going to sort of set her onto a proper treatment protocol, and not trying too many kind of outrageous kind of things. I think one of the things is to actually make sure that she does have an actual fungal infection. So maybe just all the right investigations, keep it clean in the meantime. I think the red light, if it's inflamed, if there's something along those lines, it will help. But I don't think the red light will work on a fungal infection. And then the other thing, just to be very careful for everybody, is when people are using kind of unusual cosmetic products, when they're using interesting concoctions on their skin, something that's just important to bear in mind is that those products could be photoactive. So the red light might overstimulate if they put something unusual on there, and no one is sort of thinking about whether there's a possibility of the red light to activate that. So that's something else just to bear in mind in the background, because there can be lots of products out there. Red light is often used to activate certain chemicals. So that's something we must always take into consideration when people are using unusual products. Now, did you want to ask?
Example of retinol, if are using, sorry, is that retinol or whatever on the skin? Do you have an example of a few of those?
Yeah, so the retinol, that's more UV light, but someone who's using the retinol-based products, their skin can get a little bit thinner, so they might have more of a reaction to the heat. But there are many chemicals that are light activated that we wouldn't even think are in, we don't even know them, but they might be in some of these very unusual dermatological products or cosmetic products. I think bottom line is, sessions without too much of any kind of creams, etc., on your face, unless they're absolutely indicated for red light therapy. That finger's a bit of a conundrum. Good. All right, so there are some good questions. Thanks for that, everyone. I think it might be time to wrap up for the evening. So if there's no other questions, then we will call it a night. And please keep some interesting questions. Let us have them, and then we can actually go in depth into some of them at the next Q&A, and we can dive in. Just a reminder, we'll be chatting about musculoskeletal issues and musculoskeletal health. I really just want to go through some of the research and some of the science around photobiomodulation and your fasciitis and musculoskeletal problems, and link it to some of the other sessions that we've been chatting about, bringing in the metabolic health side. So that's going to be next week's discussion. So I hope to see you guys there. Great, thanks very much.